Hello everybody, I am Dr. Sneha and welcome back to the Perio Hub. So today we are going back to 2017 to Chicago to discuss about the proceedings from the 2017 World Workshop of the classification of periodontal and peri-implant diseases and conditions. So let's get started. So this classification system was published in 2018 in Journal of Periodontology and was given by a joint committee of the American Association of Periodontology and the experts from the European Federation of Periodontology. And the unique features of this particular classification system was the multi-dimensional staging and grading system. Now, if we see certain conditions associated with oncology and other cancer conditions, these conditions are staged and graded. So in a similar fashion, the periodontal diseases were also staged in this particular classification system. There was recategorization of various forms of periodontology. So we are familiar with chronic and aggressive periodontitis. So these diseases were recategorized in this particular classification system, and ultimately there was an introduction of classification for the peri-implant diseases and conditions. So let's discuss this particular classification in detail. So if we talk about the 2017 classification, we have two major categories. So we have the periodontal diseases and conditions and the peri-implant diseases and conditions. So coming on to the periodontal diseases, we have three subcategories again underneath this. So first is the periodontal health and gingival diseases. So here the periodontium is healthy, but the gingiva or the gums is the one which is affected. The second category is the periodontitis condition, where the periodontium and the attachment apparatus itself is affected. Whereas in the third category, we have the other conditions affecting the periodontium. Coming on to the peri-implant diseases, this is further categorized into four subgroups. So here we have the peri-implant health. Then we have the peri-implant mucositis, where the mucosa is affected. We have peri-implantitis, and ultimately a new category of peri-implant soft and hard tissue deficiencies. So first let's discuss about the periodontal diseases, wherein we'll discuss about periodontal health and gingival diseases. So this is further categorized into three major subgroups. So firstly, we have the periodontal and gingival health. So here both the periodontium and the gingiva is healthy. So in this particular scenario, we have the clinical gingival health on an intact periodontium. So something which is similar to this particular picture. Whereas the second category is the clinical gingival health on a reduced periodontium. So in this particular situation, firstly we are referring to a stable periodontitis patient. So a patient who has already been treated, then when they come back for a recall and if they are maintaining their periodontium, then we term it as a stable periodontitis patient. And the second category is the non-periodontitis patients. So these are patients who have not been classified as periodontitis patients and who do not have the risk factors contributing for the occurrence of periodontitis. Now the second category in this particular subgroup is the gingivitis that is caused by a biofilm. So the first category was the gingival health. Now it is the gingivitis condition. Now the subgroup of this particular classification is associated with dental biofilm alone. So in this particular case, and the second category is mediated by systemic or local factors. Now local factors such as crowding can cause increased plaque accumulation, further causing to gingivitis. And the third category is the drug-induced gingival enlargement. So this is an example of phenytoin-induced gingival enlargement, wherein we see plaque accumulation along with the drug contributing to the gingival overgrowth. Now coming on to the third category, we have the gingivitis which is not caused by the biofilm. So in this we have subgroups such as genetic and developmental deformities. We have certain neoplasms, certain traumatic lesions and various other conditions. Now coming on to the second subheading, which is periodontitis in specific. So in this particular subgroup, the attachment apparatus or the periodontium itself is affected. So this is further again subdivided into three categories, wherein we have the necrotizing diseases, the periodontitis as a manifestation of systemic disease, and the periodontitis itself. Now coming on to necrotizing diseases, we are familiar with necrotizing gingivitis, necrotizing periodontitis and necrotizing stomatitis. So this subgroup comes under the necrotizing diseases. The second subgroup over here is periodontitis as a manifestation of systemic diseases, wherein a primary systemic disease can cause a secondary periodontal manifestation. Now, if a particular periodontal condition does not have necrotic signs and nor is it associated with a primary systemic influence, then it falls into a third category of periodontitis itself. Now, we have heard about the terms like chronic periodontitis and aggressive periodontitis. So, these subgroups have been merged into the periodontitis groups, which is further now staged, it is graded, and we estimate the extent of the disease as well. So first, talking about the staging of the disease, it is basically categorized into 4 major stages. So in stage 1, we have conditions wherein there is only 1 to 2 mm clinical attachment loss with approximately 4 mm or less probing pocket depth. There is less than 15% of bone loss, which is normally horizontal in condition, and there is no tooth loss. Now, in case of stage 2, this is a moderate stage where there is 3 to 4 mm clinical attachment loss with approximately 5 mm or less probing pocket depth. There is 15% bone loss, again, which is usually horizontal, but here certain tooth loss can be seen. Coming on to the third stage, which is severe, or now here there is approximately 5% or more of clinical attachment loss with more than 6 mm of probing pocket depth. There is approximately 33% of bone loss with vertical defects as well. There is class 2, class 3 furcation defects and can have moderate ridge defects as well. Now, in this particular scenario, there is loss of teeth which is seen. So, approximately 4 teeth or less are lost. Now, in case of stage 4, it is the severe condition which can potentially lead to loss of dentition. Now, in this particular scenario, all the features of class 3 are encompassed. Along with that, there is severe ridge defects along with bite collapse. There is pathologic migration which is seen, and there is less than 20 teeth which are remaining. So approximately 10 teeth in each arch. Now, after staging the disease in these particular categories, we can then go to deciding the extent of the disease. It can be either localized if the bone loss is around less than 30% of the teeth. It can be generalized if the bone loss is more than 30%. And the third category is the molar incisor category, wherein the bone loss is found around molars, which is usually the first molar and the anterior incisor. Now we decide the third aspect, which is the grade or the rate at which the disease would progress. So we have grade 1 or the slow progressors, wherein there is no clinical attachment loss over 5 years. Here the patient is a non-smoker and a non-diabetic, though the individual has a heavy biofilm, but there is no destruction which is seen in this particular case. Coming on to grade 2, which is moderate progression. Here there is less than 2 mm of clinical attachment loss over 5 years. And here the patient is a smoker, that is half a packet or less per day, and HbA1c is less than 7%. Grade 3 are rapid progressors with greater than 2 mm of bone loss and clinical attachment loss over 5 years and more than half a packet of cigarette per day, with HbA1c 7% or higher, with destruction exceeding more than the amount of biofilm which is present. So let's take a quick example of this particular scenario. So here we are only seeing a clinical picture and trying to decide the stage, the grade and the extent of the disease. But in reality, we have to always correlate it with the probing depths and radiographic findings as well. So let's say that this particular disease is a stage 3 disease, wherein there is more than 6 mm of probing pocket depths. There are furcation defects which are involved. Coming on to the extent, it is a generalized case. Let's say that this patient is a smoker and a heavy smoker. So they fall into the grade 3 or the rapid progressors. So in this particular fashion, we have to stage, grade and evaluate the extent of the disease. Now coming on to the third category, which encompasses the other conditions affecting the periodontium. So this involves the systemic diseases affecting the periodontiums. Certain genetic conditions like papillon leaf ray syndromes and certain neoplasms can directly affect the periodontium at a very young age. So these conditions are put under this category. We have periodontal abscesses or endodontic lesions. Then we have mucogingival deformities like aberrant frenal attachments and low vestibular depths. Then traumatic occlusions such as orthodontic forces leading to periodontal conditions. And then we have the tooth and prosthesis related factors. So now that we have finished the first category of periodontal diseases and conditions, we move on to the second major category of peri-implant diseases and conditions. So here firstly we have the peri-implant health. So this is a scenario wherein classically there are no signs of inflammation which is seen around the implant. There is no bleeding on probing and there is no evident bone loss which is seen around it. The second category is the category of peri-implant mucositis. So here there are signs of inflammation which are seen. There is bleeding on probing which is seen around the implant along with plaque accumulation. Now this condition is a reversible condition. So once the plaque is removed around the implant, the condition reverts back to the state of health. The third category over here is peri-implantitis. Now this category is also associated with plaque accumulation, but it is also characterized by the subsequent attachment loss. So the supporting structures such as the bone deterioration has occurred around the implant. Now if we consider the staging of the disease, then it is the peri-implant mucositis which occurs first, which subsequently, if not treated, leads to peri-implantitis. The last category over here is a very new category of peri-implant soft and hard tissue deficiencies. Now generally extraction of the teeth leads to certain deficiencies of the alveolar process. Now in certain conditions following traumatic extractions or extractions of fractured root or extraction of teeth with severe loss of periodontal structures, this leads to large areas of rich deformities which further has to be restored with the help of certain bone grafts or augmentation procedures. So this falls into the fourth category of peri-implant soft and hard tissue deficiency. So to quickly recapitulate the 2017 classification system, it is divided into two main categories, the periodontal conditions and peri-implant conditions. Now periodontal conditions tackle the periodontal health with gingival diseases, the periodontitis conditions and the other conditions affecting the periodontium. Whereas the peri-implant diseases tackle the peri-implant health, the peri-implant mucositis, the peri-implantitis and ultimately the peri-implant soft and hard tissue deficiencies. So I hope this video on the 2017 classification system was helpful and useful, and if it was, then please subscribe to this channel and give this video a thumbs up. I'll be back soon with the next video where we'll be discussing a new topic. So until we meet next, take good care of yourself. This is Perio Hub signing off.